Hello, everyone. My name is Kajal, and I am a current pharmacy resident at Nova Southeastern University. And today I want to speak with you about post-acute COVID-19, also known as long COVID or long hauler syndrome. This is a multi-system disease that's defined as extending beyond 3 weeks from the onset of first symptoms, and chronic COVID-19 is beyond 12 weeks. About 10% of patients who have tested positive remain unwell beyond 3 weeks, and a smaller proportion for months. And this is unclear as to why it happens to some people. Most commonly, patients experience a cough, low-grade fever, and fatigue, all of which may recur or get better. Some may also experience shortness of breath, chest pain, headaches, neurocognitive difficulties, muscle pains and weakness, gastrointestinal upset, rashes, metabolic disruptions such as poor control of diabetes, thromboembolic conditions, which includes blood clots, and depression, other mental health conditions. After excluding serious ongoing complications or comorbidities, and until the results of long-term follow-up studies are available, patients should be managed symptomatically with an emphasis on holistic support while avoiding over-investigation. I'm going to go through some areas and how to treat it. For a fever, acetaminophen or an NSAID such as Advil or Aleve can be taken. For a cough that lasts up to 8 weeks, breathing exercises and medication can be used as indicated. For breathing exercises, it's important to sit in a supported position and breathe in and out slowly, preferably in through the nose and out through the mouth, while relaxing the chest and shoulders and allowing the tummy to rise can help with the cough. The aim is for an inspiration to expiration ratio of 1 to 2, which means if you breathe in for 4 seconds, then you should breathe out for 8 seconds. This technique can be done frequently throughout the day in 5 to 10 minute bursts, or even longer if it's helpful. Other breathing techniques can be used as well to manage breathing patterns and breathlessness, but this requires specialist advice to identify which technique best suits each patient. If acid reflux is suspected, then medications such as a proton pump inhibitor can be used. Unfortunately, for fatigue, there is no evidence on the efficacy of either pharmacological or non-pharmacological therapies. The suggestion here is to exercise. This should be undertaken cautiously and cut back if there is a development of fever, breathlessness, severe fatigue, or muscle aches. Chest pain needs to be differentiated from musculoskeletal versus cardiac and should be evaluated by a doctor who will do a normal chest pain workup. Unfortunately, patients that have COVID are at an increased risk of blood clots. If you experience an area that is warm, painful, swollen, and red to the touch, it could be a blood clot and should be assessed by your healthcare provider. Additionally, if you have a cough or shortness of breath, also have this assessed. Typically, if a clot is found, a blood thinner is used to treat these. Intense cardiovascular exercise must be avoided for 3 months in all patients after myocarditis or pericarditis. Athletes are advised to take 3 to 6 months of complete rest from cardiovascular training, followed by specialist follow-up with return to sport guided by functional status, biomarkers, absence of dysrhythmias, and evidence of normal left ventricular systolic function. Ischemic strokes, seizures, encephalitis, and cranial neuropathies have been described after COVID-19, but these all seem to be rare. If you experience any of these symptoms, let a healthcare provider know immediately, which will likely result in a referral to a neurologist. Non-specific neurological symptoms such as headaches, dizziness, and cognitive blunting or brain fog can also be experienced. For this, options are supportive management and symptom monitoring. Lay accounts suggest that post-acute COVID-19 is often associated with low mood, hopelessness, heightened anxiety, and difficulty sleeping. Post-traumatic stress disorder may also occur, especially in healthcare workers and others with caring responsibilities. If this is experienced, it is important to emphasize well-being, mindfulness, social connection, self-care, which includes diet and hydration, peer support, and symptom control. Also, never be afraid to reach out to your healthcare providers. And lastly, I wanted to talk to you about postural orthostatic tachycardia syndrome, also known as POTS. This is brain fog, tachycardia, which is a fast heart rate, and severe chronic fatigue. Generally, if this is experienced, start aggressive hydration with water and speak with your healthcare provider if there are any medications that they feel could be beneficial or if physical therapy might be beneficial for you. As always, please feel free to reach out to your healthcare provider for any questions or concerns that you may have, and they will hopefully be able to guide you in the right direction. Once again, thank you so much for listening, and please reach out if you have any questions.